Hi, my name is Hisham and I am an electrical student from Polytechnic of Tuanku Sultanah Bahia, and here I stand is to share my knowledge about first aid. First aid is done to assistance given to any person suffering a sudden illness or injury, with care provided to preserve life, prevent the condition from worsening, and promote recovery. Nosebleed can be pretty embarrassing if it's happened to you in public. Here's some tips for easy treatment. First, do not tilt your head or put your head between your knee. It can make you inhale your own blood. Here is the best tips regarding nose bleeding I can share with you. Just simply pinch your nose for 10 minutes. Ankle sprain are common sports injury, but also can happen during everyday activities. An unnatural twisting motion of the ankle joint can happen when the foot is planted awkwardly, when the ground is uneven, or even when unusual force is applied to the joint. Treating the sprained ankle properly may prevent chronic pain and instability. You can use RICE guideline. R is for rest, I is to keep down the swelling, C is for compression, to control the swelling, and lastly, E is for elevate. You can elevate the foot by reclining it up above the waist or heart as needed. When someone involved in accident, the first step is you should call an ambulance. Do not move the unconscious victim from the area of the accident. Do not move victim helmet until the paramedic arrive. This is because road accident usually involves spinal cord injury. The victim might paralyze or even die if you take a wrong move. What if you had a severe blood loss during an accident? The right step is to pad the bleeding with multiple gauze pad and take the person immediately to the nearest hospital. Never ever apply tourniquet to the wounded area, or else amputation cannot be avoided. If you ever got burned, do not put petroleum jelly, butter, Crisco, or whatever you may reach and apply it on the burned area. Instead, you must flush or submerge the burned area in cool water to minimize pain and stop the heating process. Snake bite is very terrifying. Here is some tips if it happened during emergency. Do not follow random example from a movie or the internet. Cutting and sucking will make the person swallow the poison, thus he or she will die. Applying tourniquet or ice do not help actually. The victim should be moved to a safe place. Apply spleen or cover the area with clean clothes. Send them to the nearest hospital for further treatment. Check the victim for unresponsiveness. If the person is not responsive and not breathing or not breathing normally, call an ambulance and then return to the victim. In most locations, the emergency dispatcher can assist you with CPR instruction. If the victim is still not breathing normally, coughing, or moving, begin chest compression. Push down in the center of the chest 2 inches 30 times. Pump hard and fast at the rate at least 100 per minute, faster than once per second. Some apply peroxide to cuts and scrapes and leave the wounds open to air. Some authorities even think it can kill the body cells that are rushing to fend off intruding bacteria and germs trying to enter the wound. I more prefer soap and water or just clean water to flush out bits of dirt and irrigate the wound. Even hose water will do. As a conclusion, first aid is necessary to save lives, but if done in the wrong way, it can cause further injury to the victim.